Hey everybody, welcome to the third and final part of this series on the hospitalization numbers in the United States and the accuracy of those numbers. In this video, I'll be showing you the numbers, the actual numbers from the CARES Act passed in 2020, which allows hospitals to receive significantly more money from the government for each COVID patient and each patient put on a ventilator. We'll also be discussing the veracity of this idea of the hospitals all being completely full and there's patients everywhere in the hallways, all the emergency rooms are full, because this is what we were told all through 2020, or at least through most of 2020. I realize this video is a bit longer than the other two, but there was just so much I had to cover to show you the numbers and show you the evidence. So I hope you enjoy the video. Don't forget to like, share, and subscribe. Thanks for watching. Let's go here to Helio. This is helio.com. This is a news website all about health and medicine. And as you can see here, this is from February 22nd of 2019, before COVID. Once again, another article written before COVID hit the US. Or at least before it hit bad, or got really bad here in the States. So, hospitals in the United States have implemented new policies based on last year's severe influenza season, but infectious disease experts agree that America's healthcare systems would still be seriously challenged by another bad influenza season. Tight resources and underfunding mean hospitals are ill-prepared for surge events such as last year's influenza season. The 2017-2018 influenza season was the first to be classified as high severity across all age groups, according to the CDC. There were high levels of outpatient clinic and ED visits for influenza-like illness, high rates of influenza-related hospitalizations, and geographically widespread influenza activity, the agency reported. ILI was at or above the national baseline for 19 weeks, which made it one of the longest influenza seasons in recent years. In the U.S., an estimated 959,000 people were hospitalized and 79,400 people died because of influenza last season, according to figures released by the CDC. The number of cases of influenza-associated illness that occurred last season, an estimated 48.4 million people, was the highest since the 2009 H1N1 pandemic, when an estimated 60 million people became sick with influenza. That's strange. Almost sounds like we just had another bad flu season right before this one. Very strange. Last season was the worst season we have had in many, many years, infectious disease news editorial board member William Schaffner, MD, professor of preventive medicine at Vanderbilt University Medical Center and medical director for the National Foundation for Infectious Diseases, said in an interview. Based on our local experience and my conversations with colleagues, it was my impression that hospitals were often very stretched during last year's influenza season, and that, on occasion, patients were backed up in emergency rooms. Schaffner said hospital capacity across the country was stretched but not broken, and most hospitals were able to manage because they had a pandemic preparedness plan in place. That plan probably was, at least in its early stages, put into operation last year in many hospitals, he said. Among other plans of action, notice went out to all medical providers that patients needed to be discharged as promptly as medically appropriate to make sure there were enough beds available to accommodate the influx of patients with influenza. Once again, we have another article citing the fact that they made it explicit that people who were not in serious condition and were medically appropriate to leave the hospital, they had to go, to make sure the beds were not full, to make sure they had enough space. Keep this in mind. The CDC noted that the estimated number of hospitalizations during the 2017-2018 influenza season exceeded the number of staffed hospital beds in the United States, which is 902,202. That's the amount of beds. This is just the influenza season, not the whole year. This was just those few months of the influenza season. There were more people in the hospitals than there were beds. Oh, so this happens sometimes. So our Dr. Schaffner continues on. He says, you cannot be perfectly prepared for any large pandemic, whether flu or otherwise. Schaffner said, our nation is tight on hospital beds. Intensive care unit facilities are finite. Ventilators are finite. The staff that is knowledgeable about managing patients on ventilators is finite. So if we were to be hit in the United States and around the world with a major new pandemic influenza virus, I think our medical care facilities would be very, very challenged. It's almost like this guy William Schaffner's some kind of crystal ball. Woo! Got his tarot cards out. So let's keep going. According to Michael T. Osterholm, PhD, MPH, Regents Professor and Director of the Center for Infectious Disease Research and Policy at the University of Minnesota, hospital capacity is a concern not just in severe influenza seasons, but during any major healthcare crisis. Oh, so it happens all the time, basically, is what he's saying. Very few institutions anywhere in the country have surge capacity, meaning unused capacity, just sitting there waiting for a crisis to happen, Osterholm told Infectious Disease News. He says, we worry all the time about the need for surge capacity. Last year's influenza season brought preparedness issues to the surface. All right, good. We are constantly dealing with shortages and the limited capacity to respond to a surge situation, and that's the reality of healthcare today. Influenza is probably the one thing out of all the diseases we deal with that challenges that surge capacity issue, short of a localized crisis like terrorism or a mass shooting. Flu is in some ways the disease that is a barometer that tells us how capable we are. When you hear about patients being in the hallways and not having room for them, that really is not necessarily a function of the influenza season. It is a function that we just hit capacity. So Doc, wait a minute. Doc, time out. You're saying this happens even outside of flu season? Like, what? But that can't be right. We were told this is all crazy. This doesn't happen. Beds are filled up. Hospitals are filled up. This is not normal. But you're saying this happens all the time. You and several other doctors said this is typical. Strange. Let's keep going. So federal funding cuts are to blame. So federal funding cuts to hospitals and the public health system are a major reason for the lack of surge capacity, according to Jeffrey S. Duchin, MD, health officer and chief of the Communicable Disease Epidemiology and Immunization section of Public Health for Seattle and King County, Washington, and a professor in the Division of Infectious Diseases at the University of Washington. So this guy sounds like he might know what the hell he's talking about. I mean, I don't know. Just maybe. He says, our hospitals are struggling with the ability to meet medical surge events, even in the absence of a severe flu season. Wait, so two different doctors in two different parts of the country are saying the exact same thing? No, this has to be some conspiracy website. What is this? This has got to be some far-right neo-Nazi conspiracy QAnonymous website. What is this nonsense? Impossible. Even before flu season in the Puget Sound region, we have experienced EMS diversion, long ED wait times, caring for patients in untraditional spaces like hallways, and having higher than usual patient-to-staffing rates. What this tells us is that there is a clear need for healthcare systems to better operationalize medical surge strategies. Hospitals have lost a lot of funding, as have public health departments related to emergency preparedness. Huh. Wow. Let's keep going. For example, Dushin noted that the Hospital Preparedness Program, HPP, the only federal source of funding for hospital preparedness, has been more than halved since 2003. HPP appropriations were cut from $514 million in fiscal year 2003 to $255 million in fiscal year 2017, according to the nonprofit Trust for America's Health. Hold that thought. I'm about to show you some fun information. So I looked it up, and the HPP, this is real, this hospital preparedness program, all this is legit. And I'm about to blow your mind, because I know there's a whole lot of people who say, oh, it's Donald Trump's fault. Donald Trump, he's the one that did this and let my grandmama die. Well, time out. Slow down. I'm going to show you something really, really cute. The U.S. Department of Health and Human Services, Office of the Assistant Secretary for Preparedness and Response. Funding and grant opportunities. Oh. And here you can see fiscal year 2009 all the way to 2019 funding for HPP, the Hospital Preparedness Plan, which our doctor from Seattle, Washington, University of Washington, was mentioning, saying, we've been cut. Well, let's take a look when those cuts happened, shall we? Yeah. We are. Enjoy. So here we have fiscal year 2009 Hospital Preparedness Program. I'm not going to bore you with all the details, but we're just going to go. Grand total $362 million in fiscal year 2009. Sounds good. $362 million for health preparedness. Sounds good. Here we have 2010. Fiscal year 2010 Hospital Preparedness Program. Funding by state, cities, territories, etc. $390 million. Oh my goodness, that's amazing. We got so much money. Thank you. That's awesome. Here we have, it's hard to read it, but 2011 revised HPP funding table. Let's have a little look. Grand total $352 million. Oh, they cut it again. Damn it, they cut it by almost $40 million. Gosh dang it. Here we have fiscal year 2012. Where'd it go? Boop, 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 boop. There we are. $351 million. Okay, we're still up there in $350 million. All right. Thanks, Barack. Sounds good. Here we have fiscal year 2013. All right. How's it looking? 331? Hang on, what? 31? It went from 51 to 31? You cut it by 20 million in 1 year? What a dick. Well, let's keep going. Surely they wouldn't cut it again. Would they? Well, here we have Hospital Preparedness Program and Public Health Emergency Preparedness Funding, fiscal year 2014. Hospital Preparedness Program funding, 2014. This is it, HPP 2014. $228 million. They cut it by over $100 million in 1 fucking year. You want to blame Trump? You're stupid. The hospital funding got cut by over $100 million under President Obama. Now you really want to shit your pants and get pissed off? Watch this. Remember this number. Next year, 2015 funding, same number, 228.5. Next year, 2016 funding, 228.5. Next year, 2017 funding, 228.5. Holy Jesus, Trump didn't cut it. He kept it the same. Now let's watch something funny. 2018. Oh, he cut it by 1 million. Gosh, dang it, he cut it by like 1.5 million. God, there you go. That must be it. Is that extra 1.5 million that killed it, Grandma? That's it. Oh, wait. Here's 2019. It went back up to 231. So it actually went up under President Trump. Your hero, Barack Obama, cut healthcare funding by over $100 million. Trump actually made it go up by about $3 million. So why is all of this important, you're asking? What does this have to do with me? Well, let's go back to the original hypothesis. My original quote earlier in this video was talking about how we keep getting told all the hospitals are full. The hospitals are filled to the brim, patients are everywhere, patients are in the hallways, etc., 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 etc. Now, one quick cursory glance at YouTube or TikTok, and you search, I don't know, nurses dancing compilation. Something like that. Takes you about 30 seconds. Or just nurse dancing videos. Anything like that. And you'll get a bevy, a plethora of videos of nurses who filmed themselves and choreographed and planned and recorded these big productions in their hospitals. Dancing. Now, I've taken the liberty of getting a few short clips and putting them together. I removed the music to make sure I do not get a copyright strike. But just, I want you to take a look. I really focus on the horror, the absolute terror of all the dead bodies and the patients in the hallways and in the rooms during these videos while these nurses are dancing. I mean, how could they dance? Where do they find the time to do it? It's so brave and bold of them to make the time to make these videos with all these sick patients. I don't, they're saints, they're angels. How could they ever find the time to do this? Enjoy, watch. Huh. It almost seems like it's all bullshit. I mean, it just seems like, if there were dead bodies and patients all throughout the hallways, like we keep getting told, we would see them in those videos, right? But I didn't see any. In fact, those hospital wings all looked empty. Where are all the COVID patients? Huh. Well, now you're saying, nah, Bohemian, you're stepping into conspiracy theory stuff. Come on. Can't be true. None of this is real. Come on. Surely, there's a logical explanation for that. Come on. Well, that's what I'm about to show you. So here I have from USA Today, far right leaning neo-Nazi USA Today. I know, it's probably some conspiracy theory from some far right activist group. USA Today. Fact check. Hospitals get paid more if patients listed as COVID-19 on ventilators. This is their official fact check. So if you want to fact check me, bro, you're fact checking yourself. Enjoy. So, the claim. Hospitals get paid more if patients are listed as COVID-19 and on ventilators. Senator Scott Jensen from Minnesota, a physician in Minnesota, he's a doctor, not some dude, he's a doctor, was interviewed by the Ingraham angle. I know it's not Ingraham, come on. Host Laura Ingraham on April 8th on Fox News and claimed hospitals get paid more if Medicare patients are listed as having COVID-19 and get 3 times as much money if they need a ventilator? Well, that's interesting. The claim was published April 9th by The Spectator, a conservative publication. Oh, it's got to be a conservative, far right. Bleh. WorldNet Daily shared it April 10th, and according to Snopes, a related meme was shared on social media in mid-April. Oh, well, it's got to be evil. It's got to be far right then if it's a meme. All right? So, Jensen took to his own Facebook page April 15th, saying, in part, how can anyone not believe that increasing the number of COVID-19 deaths may create an avenue for states to receive a larger portion of federal dollars? Already, some states are complaining that they are not getting enough of the CARES Act dollars because they are having significantly more proportional COVID-19 deaths. Okay. All right, well, let's take a look. What does all this mean? So Jensen said, hospital administrators might well want to see COVID-19 attached to a discharge summary or a death certificate. Why? Because if it's a straightforward garden variety pneumonia that a person is admitted to the hospital for, if they're Medicare, typically the diagnosis-related group lump sum payment would be $5,000. But if it's COVID-19 pneumonia, then it's $13,000, and if that COVID-19 pneumonia patient ends up on a ventilator, it goes up to $39,000. Let this sink in. If you're in some major metropolitan area like New York City or Los Angeles or Chicago, and you or your friends or your family are being treated like garbage and stuck out in the middle of a hallway with COVID or some other pneumonia-like illness because the hospital is full and no one is being discharged, it's because of plain old human greed. They want those greenbacks. They get more money if they throw your grandma on a ventilator than if they just regard her as, it's the flu. No, it's pneumonia. Keep her here an extra week. She might have COVID. Put her on that ventilator. Make sure we get more money. Let's keep going down this rabbit hole. Jensen clarified in the video that he doesn't think physicians are gaming the system so much as other players, such as hospital administrators, who he said may pressure physicians to cite all diagnoses, including, quote, probable COVID-19 on discharge papers, what the hell, or death certificates to get the higher Medicare allocation allowed under the Coronavirus Aid, Relief, and Economic Security Act, also known as the CARES Act. Past practice, Jensen said, did not include probabilities. So now all they have to do is say, well, it's probably corona, and the hospital gets more money. Oh, to hell with being sure. Well, maybe it's pneumonia. Maybe it's the flu. Maybe it's some other upper respiratory illness. Nope, it's probably COVID. It's COVID. Gotta be. Get them dollars. If you're not getting pissed off yet, you probably need to check your pulse or your brain. You're being played. Let's keep going. He noted that some states, including his home state of Minnesota, as well as California, list only laboratory-confirmed COVID-19 diagnoses. Others, specifically New York, good job Cuomo, list all presumed cases. All presumed cases. You don't even have to confirm it. Which is allowed under guidelines from the Centers for Disease Control and Prevention as of mid-April, and which will result in a larger payout. They are making money off of you and your ill family members and dead grandma. They're putting money in their pocket by keeping you in the hospital an extra week, by putting you on that ventilator that you might not have needed. Jensen said he thinks the overall number of COVID-19 cases have been undercounted based on limitations in the number of tests available. I happen to agree with that. The numbers are completely wrong. Because as I said before, I'm fairly positive there's going to be thousands, if not tens of thousands of people who had the virus and showed very little, or if at all, any mild symptoms, and so they didn't go to the hospital. They never got tested. They were worried about getting quarantined. They were worried about being stuck in a hospital surrounded by sick and coughing people, and thought, well, I might get better health care if I just stay at home for a couple weeks. I guarantee you the numbers are wrong. So let's look at this provision in the Relief Act. The coronavirus relief legislation created a 20% premium or add-on for COVID-19 Medicare patients. There have been no public reports that hospitals are exaggerating COVID-19 numbers to receive higher Medicare payments, and nothing public. But, I haven't seen the emails from the hospital administration, so who knows? Jensen didn't explicitly make that claim. He simply suggested there is an avenue to do so now that plausible COVID-19, not just laboratory-confirmed cases, can be green-lighted for Medicare payment and eligible for the 20% add-on allowed under the Relief Act. And just so you know, we're not just talking about some conspiracy theorist. Let's keep going. USA Today reached out to Marty Makary, a surgeon and professor of health policy and management at Johns Hopkins Bloomberg School of Public Health.
Well, Brennan, those are very prestigious schools.
I smoked pot with Johns Hopkins.
Makary said in an email April 21st that what Scott Jensen said sounds right to me. This isn't some voodoo witch doctor. This isn't some podunk guy in the backwoods. This is an actual doctor at Johns Hopkins. No big deal. Right, bro? So, I'm not concerned with how Medicare pays. In case you're wondering, well, you've got no proof. Well, citation needed. Citation needed, bro. Oh, okay. Citation needed? Cool. No problem. So, Ask Fact Check weighed in April 21st. The figures cited by Jensen generally square with estimated Medicare payments for COVID-19 hospitalizations based on average Medicare payments for patients with similar diagnoses. Huh. Ask Fact Check reporter Angelo Fischera, who interviewed Jensen, noted, Jensen said he did not think that hospitals were intentionally misclassifying cases for financial reasons. But that's how his comments have been widely interpreted and paraded on social media. Yeah, I wonder why. Because it sounds like it sure as shit is possible. Ask Fact Check's conclusion? Recent legislation pays hospitals higher Medicare rates for COVID-19 patients and treatment, but there is no evidence of fraudulent reporting. Okay, just because you haven't seen the evidence doesn't mean it don't exist. It's called an investigation. And I'm sure eventually we will get an investigation into this. It's just going to take about 20 or 30 years for it to get declassified. Here we go. Here we have it. This is their ruling. True. We rate the claim that hospitals get paid more if patients are listed as COVID-19 and on ventilators as true. Oh. So the motivation does exist for them to, let's say, cook the books on their numbers to get more dollars. There you have it. And just for those people who are worried about citation, bro, here you go. Our fact-check sources: The Spectator, WorldNet Daily, Snopes, PolitiFact, Kaiser Health News, FactCheck.org, Coronavirus Aid, Relief, and Economic Security Act, U.S. Department of Health and Human Services, VerywellHealth.com, American Hospital Association's Special Bulletin. So if you want to fact-check me, you got to fact-check yourself. You got to fact-check the government. You got to fact-check Snopes. Good luck with that one. This isn't a conspiracy. This isn't some theory. This is fact. I'm just reading straight from the news. Don't get mad at me. Don't kill the messenger. I'm just showing you what you missed last year. This article was written last year. And all I had to do was go and spend just a couple hours of doing research of basic information about the flu, influenza, and COVID, and the numbers in the hospitals, and the money spent. Because when you look at actual evidence coming out of the hospitals, it doesn't look like they're all filled to the brim with sick and dying people. It just sounds that way because, well, the hospitals are getting a whole lot more money. And in certain states, they don't even have to prove the person had COVID. It just has to be a probability. So you just, move the decimal point over a little bit and, carry the 2. And, nope, it's COVID. And I've seen 7 and 8-year-olds that can figure this little game out. It's called cheating on your math test. Come on. So anyways, I think that's enough to get me probably kicked off of YouTube. If you don't see me in the next week or so, you can always find me on Gab. I am on Gab and BitChute. I'm also on BitChute. I will post some links down in the descriptions of this video. If you like this video and you want to see more, definitely hit the like, hit that share, man. Or at least not hit the share, but share this. People need to know. I'm not some genius. I'm not hacking the web. I'm just looking at actual news articles that most people skipped over. This is basic information. It's out there. No one's reading it. We can simply prove, by deduction, the numbers are wrong. We're being lied to. Hey, Arnold, what would you call this?
You sales! It's all bullshit! All of it!
Thank you so much for watching. If you enjoyed this video and you would like other people to know about this, because I think a lot of people just don't know. This was information that was passed over and no one paid attention. So please share this video, share the whole series with friends and family. Make sure everyone knows what's going on. I would really appreciate it. I'm sure they would really appreciate knowing some of the truth that we seem to have missed. Anyways, thanks for your time. Until next time, I remain the Neo-Bohemian.